Hello everyone, my name is Shanaz and I welcome you all to my channel Nurses, the Heart of Healthcare. If you are working as an ICU nurse, especially in Neuro ICU or as an emergency nurse or looking forward to work as an ICU nurse or as an ER nurse, then this video is going to be of great help to you as I am going to cover one of the important topic, one of the important component that as an ICU nurse or as an ER nurse we must be familiar with. Not just familiar with, but we also must master the art of assessing it, and that is nothing but the GCS, that is Glasgow Coma scale. Okay, so in this video we are going to cover what is Glasgow Coma scale and how to go about the assessment of it. Okay, so which is very important. Okay, not just memorizing the score but how to assess it practically when it comes to assessing the patient in ICUs or in ER. So before moving ahead, a small gentle reminder that if you are new to my channel, I would really appreciate if you subscribe my channel, and if you find the content helpful, please motivate me by liking and sharing my videos. Okay, so let's get started. Glasgow Coma scale, GCS. Okay, it is what I can say, it is one of the golden standard now of neurological assessment, especially for the trauma patient, and it has become a method of choice. It has become a very important part of neurological assessment, and it is named after the university where it was initially developed, okay, by the two wonderful neurosurgeons, that is Graham Tisdale and Brian Jennett. Okay, let me show you their photos. He is Sir Graham Tisdale and he is Brian Jennett. Okay, and these two wonderful professors of neurosurgery at that time at University of Glasgow, GCS is the result of their combined effort. Okay, so they developed this scale to assess the level of consciousness in patient following head injuries, but now it is widely used throughout the world in the first aid as well as in acute medical care units for trauma patients as well as for other patients. Okay, so now it has become a standardized approach to assess the patient's level of consciousness. Okay, so it is these two wonderful guys who developed this scale, Graham Tisdale and Brian Jennett, in the year 1974. Okay, so this was a short introduction, and GCS, this scale is used for the people above the age of 2. For kids, I mean in the pre-verbal stage, below 2 years, pediatric GCS scale is there. Okay, that is different. Okay, so here we are going to do the adult one. So now let us see what are the components of GCS. There are three main components of GCS that we must know. Okay, one is the eye response. Okay, the three main components of GCS, one is eye response or the ocular response, second is the verbal or the oral response, and the third one is motor response. Okay, and each component has been given a score, and we will get the total GCS score by adding up, by sum of all this. Okay, so eye response, the total score is 4, 1 to 4, E4. For verbal response, the total score is 5, 1 to 5. And for motor response, the total score is 6, 1 to 6. It is never 0. The minimum score is 1 and the maximum score is 4, 5 and 6. Okay, so when you sum up all these elements, the total score will come up to 15. Okay, so the total score is 15, minimum is 3. Okay, so the score ranges between 3 to 15. 15 is the best score, that means the patient is fully conscious, whereas 3 is the worst score where the patient is totally unresponsive. Okay, so now let us see how to assess GCS, each component in detail. Okay, not just memorizing the components, okay, the spontaneous, to speech, to pain, but how to do the assessment, that we have to know practically. Okay, So now let us see. The first one is eye response. Okay, the first component is eye response. How to assess the eye response in GCS? The total score in eye response is 4. Okay, 1 to 4, E4. When you will give 4, 4 will give to the patient when the patient's eyes are open. Okay, spontaneously open. Okay, you receive a patient in ER or you are assessing the patient in an ICU, you see that the patient's eyes are open spontaneously, then you will give the score 4, E4. Next, the patient eyes are closed. You have received a patient, the patient eyes are closed. Then you will call the patient. Hello sir, hello ma'am, please open your eyes. How are you? What happened? Something like that. You will speak something, okay, without touching the patient, fine. You will speak something, and to speech when the patient opens the eyes. To speech when the patient opens the eyes, that time you will give the score 3. Okay, that time you will give the score 3. Fine. Then next is, you have seen that the patient's eyes are closed. You called out the patient name or hello sir, hello ma'am, you have addressed them and they have not responded. The patient did not open the eyes to speech even after calling out. Then next what you will do? You will give a painful stimuli to the patient. And how you will give the painful stimuli to the patient? That you can see it here. How to give the painful stimuli to the patient? See, painful stimuli to the patient we can give the patient either central stimulus or peripheral stimulus. Central stimulus is when you are stimulating the patient center of the body. Okay, that was sternal rub, but it is no more recommended now. But then you can do trapezius squeeze. Trapezius squeeze, as you can see over here, what we are going to do is, with the help of our thumb and index finger, we are going to squeeze or pinch at the trapezius muscle here on the shoulder. Okay, as you can see here. Fine. Otherwise, we can apply supraorbital pressure. That is here at the supraorbital region, here at the notch. What we are going to do is, with the help of our thumb, we are going to apply pressure. Okay, we are going to give a painful stimuli there, and then the patient opens the eye. That time you will give the score 2. That means we are giving a painful stimuli to the patient, and to that painful stimuli the patient opens the eyes. That time we will give the score 2, E2. Okay, the patient's eyes are closed, we have called the patient did not open the eyes, we have given a painful stimuli to the patient, still the patient did not open the eyes. That means there is no response from the patient. There is no response from the patient, none, even to the painful stimuli. Then that time we are going to give the score 1, E1. Okay, the minimum score is 1, E1. Fine. So the total score for eye response is 4, E4. If the patient's eyes are spontaneously open, then 4. If they open the eyes to speech, then 3. If they open the eyes to painful stimuli, 2. If there is no response at all, then 1. Okay, this is how you are going to test the first component of the GCS, that is the eye response. Fine. Now you have finished with the eye response. Then next, assessing the verbal response. Okay, the total score for verbal response is 5, V5. Okay, so when will we give 5 to the patient? We give 5 to the patient when the patient is oriented to time, place and person. And how we'll know that the patient is oriented? We'll ask questions to the patient. Okay, we can just ask the patient some general questions. Okay, like what is your name, what is your age, where are you right now? Okay, the patient says the name correctly, age correctly. Okay, and he says that yes, I am in hospital, I am in the emergency department, I am in an ICU. Okay, then we'll ask why you have come there. Okay, some simple general questions we can ask to the patient related to time, place and person. And when we see that when the patient gives all correct answers, then we can say that the patient is oriented. Okay, that time we can give the score 5 to the patient. Okay, then next is, suppose we are asking the patient, where are you right now? Okay, we have asked the patient, where are you right now? Then the patient is confused whether he is at home or in a hospital or in his office, or where exactly. He says that I don't know where am I exactly right now, I don't know why I have come over here. Okay, he's not oriented, he is disoriented, he's confused. Or we ask him, what is your age? He's confused. Or which month it is. Okay, see, date sometimes, even the normal people don't remember. Fine, we can also ask the patient, what is the date today, or what was the date yesterday. This also we can ask. But numericals we cannot depend completely. Why? Because sometimes even the normal people, they don't remember the date. Okay, they remember the day, they don't remember the date, they remember the day, they don't remember the date. It happens even with the normal people. So we cannot give them the GCS 4, right? Okay, so don't depend on the numerical values, but we can ask them like, what was the day, which month it is. At least month people remember, right? Which month it is. Okay, why you are here. Fine, why you are here, where you are exactly. And suppose if some relatives are standing, then who is she, how is she related to you, or how many kids you have. Okay, or what's your husband name, what's your wife name. Okay, what is your father name, what is your mother name. Like this, some general questions that each which we are expecting a normal person to be aware of. Okay, like these questions we can ask to them. And if the patient is answering them correctly, then they are oriented, that's good. But if the patient is not oriented or confused, they don't know, they are not able to answer correctly. Okay, they are saying, I'm not sure, I don't know, maybe it is September or October or December, when it is August exactly. Yeah, or maybe they say, I don't know why I'm here exactly. Is this hospital, or is this my home, or is this my grandma's home, or something like that. Okay, they are not aware of the surroundings, they are not aware of the people. Or when you ask them, who is she, or how many kids you have, they don't remember. I think 2 kids, or I think 3 kids. They don't remember exactly, they are confused, they are not oriented. Then that time you will give them the score 4. Okay, then next, we ask some question to the patient, and then they are not able to frame the sentence. They are not able to frame a sentence, but they are just speaking some words. They are just speaking some words. They are not able to frame the sentence, but they are just speaking some words. Okay, inappropriate words. Then that time we give them the score 3. For example, we are asking them something, okay, like what is your name, or what is your age. Then they are saying like, jacket, my room, or pen, pencil, or something like that. You are asking them something and they are telling something else, completely irrelevant. Okay, completely irrelevant, and that too they are not able to frame a sentence. It's only words, few words. Okay, then that time we give them the score 3. Okay, irrelevant and inappropriate words. Fine, so that time we give them the score 3. Then next is, if the patient is not able to speak words but just making sounds, you are asking something to the patient is just moaning and groaning, making only sounds, incomprehensible sounds, like like that. Just they are making some sounds. When we are groaning, when we are moan, how we make the sounds, they are just making some incomprehensible sounds. Then that time we give them the score 2. Okay, they are neither speaking, forget about the relevant answers, irrelevant answers, forget about the words, they are just making sounds, no words also. Then that time we are giving them the score 2. Okay, and if there is no response at all, there is no response at all. You are asking them something, you are giving them painful stimuli, whatever, still there is no response. The patient is not speaking anything, no response, nil. That time we are going to give the score 1, V1. Okay, so this is how we are going to check for the verbal response. But when we are checking for the verbal response, few important things that we may have to note, that is, one challenge that we may face is if the patient is dumb. Okay, means the patient cannot speak, naturally he is dumb, then that time it is a challenge to assess for the verbal response. Yeah, okay. Then one more is when the patient is having when the patient is intubated, endotracheal intubation is there, then that time also we cannot assess. So what we will write, we will write E4 or E3, whatever we have got for the I response, and V we will write ET. ET stands for endotracheal tube. Okay, so we will not write V1, we will write VET. Okay, or if the patient is having a tracheostomy, okay, that is the surgical opening, then that time we will write V and small t there down. Okay, we are not going to give any score to them, we will just write ET if the patient is intubated, endotracheal intubation, or T if patient is having a tracheostomy. Okay, so that will be understood that verbal response could not be assessed because the patient was intubated or having a tracheostomy. Okay, or if the patient is dumb, then we can write NA, not testable. If the patient is dumb, we cannot assess the verbal response. Yes, obviously. So that time what we will write? NA, not NT, not testable. Okay, and suppose if the patient is mentally retarded or mentally challenged or a psychiatric patient, this is also a very big challenge in assessing the verbal response. Okay, and also when the patient is we have to check, when we are checking the GCS, we have to make sure if the patient is has been given paralytic agents or sedated in a postictal stage. Okay, all these factors need to be considered when we are checking GCS. These are the challenges when we are checking GCS. Fine. Okay, so I hope how to check the verbal response is clear. Fine. Then the next one is how to check the motor response. Okay, the total score for motor response is 6. Okay, M6. So I response E4, verbal response V5, and motor response is 6, M6. So how to assess? When you are going to give 6 to the patient, that is full marks, that is when the patient obeys the command. Okay, so we are going to give simple commands to the patient. We are not going to ask the patient to get up and dance or to do some hard work. We will just give some simple commands to the patient, like hold my hand, grip my finger, or make a fist, open your mouth. Okay, open your eyes or close your eyes, or lift your hand, lift your limb. Okay, like this simple commands. Okay, turn this side, turn that side, like this simple commands we can give to the patient, and the patient is obeying the commands or can follow your orders. That means the patient is fully conscious and oriented. Then we are going to give the score of 6 to the patient. Okay, the patient is perfectly fine, 6. Okay, then next, the patient is not able to follow the commands, then what you will do, you will give a painful stimuli to the patient. Okay, and how to give a painful stimuli to the patient, that we have already discussed before, that is trapezius squeeze or supraorbital pressure. Okay, and even this one, finger nail bed pressure also we can give. Okay, so trapezius squeeze when we give, as I said, with the help of our thumb and the index finger, we are going to squeeze or what we say, pinch here on the shoulder at the trapezius muscle. Okay, and when we give this painful stimuli to the patient, we see that the patient reaches out where the pain is there. Okay, the patient is able to localize the pain. Okay, what the patient does, the patient is able to reach where we have given the painful stimuli, and he is trying to hold our hand or trying to remove our hand. Okay, then that time we can give the score 5. Okay, that means the patient moves to the localized pain. Okay, the patient is able to locate where the painful stimuli has been given to him or her. Okay, he is able to locate his pain. Okay, so that time we will give the score 5. Then next is flexion or withdraws from the pain. That means we have given a painful stimuli to the patient. Suppose we have given a trapezius squeeze. Okay, a painful stimuli to the patient. Then, as you can see here in this picture, withdraws from pain. The patient is withdrawing from the pain. The patient is moving the body. Okay, with moving the body means moving the body, but not able to reach out till where the painful stimuli has been given. Okay, not able to localize the pain where the painful stimuli has been given, but moving the body. For example, whenever we are giving pain to your body or to our body, then what we are going to do, we will try to protect our body. Yeah, we'll try to move our body parts towards our body. Okay, so that is normal flexion. Okay, and that time we are going to give score 4. Okay, when there is normal flexion or when the patient withdraws from pain, okay, withdraws the body to away from pain, then that time we are going to give the score of 4. Okay, then next one is abnormal flexion. Here, as you can see over here, in abnormal flexion, the patient, yeah, here as we can see, in abnormal flexion, the patient makes a fist like this, and his hands are flexed and adducted till the sternum. Okay, he is going to lift his hands till the sternum. We have given a trapezius squeeze and the patient is moving his upper limbs till the sternum. Okay, not able to reach out the pain, not moving the body away from the pain, but able to reach out till the sternum. That is abnormal flexion. Okay, so that time we are going to give the score 3. For normal flexion 4, for abnormal flexion 3. Okay, next, if the patient is extending to the pain, extension, okay, abnormal extension, then that time we'll give the score 2. Okay, that is, you can see here, abnormal, the patient is moving the when we are giving a painful stimuli to the patient is moving the upper limbs away from the body. You can see the rotation of the limbs over there. Okay, the fist and the hand, how they are rotated outward away from the body. Okay, so this is abnormal extension, and that time we are going to give the score 2. Okay, here you can come across some words, as you can see. Yeah, this one here, it is very nice. Yeah, here as you can see here the first one, motor response. Okay, you are giving some command to the patient is obeying. We are going to give the score 6. And here, when the patient is not able to obey the commands, we are going to give a painful stimuli to the patient, either trapezius squeeze or supraorbital pressure, or we are going to apply nail bed pressure. Then that time the patient, what he does, the patient is able to localize the pain where we have given the painful stimuli, then we'll give the score 5. If the patient withdraws from pain, then we'll give 4. Or then if the patient is having this one, abnormal flexion, then see, this is abnormal flexion, like see, you can see this is abnormal flexion, then that time we'll give the score 3. Okay, the patient is not able to localize the pain but able to reach out till the sternum, with the hands adducted like this, making a fist. Okay, like when we get fear and all, how it is, like that. Okay, that kind of post. So this is abnormal flexion, that time we'll give score 3. And this is abnormal extension. You can see here the hands are externally rotated outside, away from the body, then that time we will give the score 2. And if there is no response at all, we'll give score 1. Here you can see here. this is called decerebrate or decorticate. Okay, so if it is abnormal flexion, it is decorticate, and abnormal extension, it is called decerebrate position. Okay, and these are the signs of brain injury actually. Okay, when there is an injury to the brain, then that time we are going to see this kind of position when we are giving a painful stimuli to the patient in motor response. Fine. So this is how we are going to assess the, yeah, here you can see here, decorticate posturing and decerebrate. Decorticate is abnormal flexion and decerebrate is abnormal extension. Okay, so these are the manifestations of the brain injury. So I hope the components of how to assess each component is clear. Okay, so total score is 15. Fine. E4, V5, M6. Total score is 15. The best score is 15. That is, the patient is fully conscious. And the least score or the worst score is 3. That is, the patient is totally unresponsive. Okay, and how we are going to give the gradings? If the score is between 13 to 15, then it is mild injury, mild brain injury. And if the score is between 9 to 12, it is moderate brain injury. And if the score is between 3 to 8, then it is severe brain injury or severe brain damage. Fine. Okay, then it is never 0. 0 is the patient is dead, right? There is no need to assess only. Fine. So the minimum score is 3. Though we are in GCS score, in GCS, you know, we are not giving the score 0, because the patient is not responding, but the patient is still alive. The patient is still alive. So that's why the minimum score is 1. Okay, not 0. In each component of the GCS, if you see, the minimum score is 1. Okay, that's why we are getting the minimum score 3, but not 0, because the patient is still alive. Though the chances of survival, you know, is hardly less than 20%, but still the patient is alive. That's why we are giving the score least 1. Okay, so this is GCS, that is Glasgow Coma Scale, which is a very important tool, very important part of the neurological assessment. Okay, and as an ICU nurse, as an ER nurse, we must be familiar with this, and we must not just memorize each component, but should also know how to assess it, how to report it, you know, assess it, report it, and, you know, act. Okay, because assessment of GCS is not only important initially, but it also helps you to know if the patient condition is deteriorating. Okay, if the GCS is going down, okay, then that means the patient condition is deteriorating. Okay, if the GCS is 8 or less, the patient may be require intubation. Okay, because they are not able to support their breathing. Okay, they may be drooling of pooling of secretions. Okay, and they will be threatened airway. Fine. So that they may require intubation. So if the GCS is going down, then, you know, it will help to change the plan of care. And if the GCS is improving, that means whatever the treatment we are giving or whatever care we are giving, that is effective. Okay, so it will help us to plan our care. Okay, if it is deteriorating as well as it is improving. So it's very important that we must be familiar with each and every component of it and assess it properly, record it, report it, and take timely action. So this is GCS, Glasgow Coma Scale. I hope this video helped you to understand how to assess GCS, and if you find it simple and easy to understand, then please do subscribe my channel and like and share my videos. And thanks for watching. Stay connected. Have a great day and keep smiling. Thank you.